The middle of the road and moderation is crucial. Like, you can have a glass of wine here or there. You can have a steak now and then, but it's like you don't have to do everything to such an extreme where you only eat steak or you only eat egg.
Welcome to Radically Loved Radio. I am your host, Rosie Acosta, yoga teacher and teacher trainer, mindfulness coach, speaker, and creative writer. I am also the founder of radicallylove.com, a website where you can go for more information about yoga, mindfulness, meditation, and lifestyle advice. On this podcast, we talk to people within our health and wellness community that are creating content through the ritualistic practice of yoga, meditation, or overall mindful living. We hope to create value in your life so that you can achieve your highest potential and live a radically loved life. To stay in touch with us, just follow me on Instagram and Twitter at Rosie Acosta and on Facebook at Radically Loved Rosie. You can sign up for our newsletter on radicallylove.com to stay up to date on future workshops, retreats, and latest podcasts. Hey guys, most of you know that I have returned back to a plant-based diet, so my beverage consumption has increased quite a bit. Don't judge. I know there's some of you out there that really enjoy beverages. So one of my favorite things to drink lately, which I'm consuming a lot of, is Four Sigmatic's new Golden Latte mushroom mix. It has shiitake and turmeric in it. It's totally organic, caffeine-free, vegan, and only 1 gram of palm sugar per serving. I love being able to travel with these little packets because they're really easy to make. All you need is some hot water. Some of the additional ingredients in the Golden Latte are adaptogenic tulsi, warming ginger, and a pinch of black pepper to support turmeric's skin-loving properties. So not only do your insides feel amazing, but your skin looks great. Go to Four Sigmatic now and enter promo code RADICALLYLOVED, that's RADICALLYLOVED, to get 15% off of your entire purchase. Be sure to check out all the other products that they have there as well. Hey listeners, we need your support. Help us by subscribing and rating to this podcast. Send us a snapshot of your review or comment, and we will send you a very special Radically Loved gift. Send your comment to info@radicallyloved.com. You can also click on the show notes here on this podcast for more information. If you want to be part of our community, please click the link to our private Facebook group on the show notes of this particular podcast so you can be the first to hear of upcoming trainings, retreats, and special Radically Loved events. Thanks so much for listening. I had all these aspirations of becoming a doctor, right? And so after I went through that schooling, like the first 2 years, I was like, there's no way. It's just not that I didn't feel like I couldn't do it, but it was just like, I think I was just so overwhelmed. So I'm always so inspired by women, just in general, just women. I'm just inspired by women. I love women. But when I get the opportunity and the privilege to talk to a doctor, and not just any doctor, but a cardiologist, I get really excited.
Okay, good. Well, I get excited when I can talk to someone who seems like they have a much calmer mental life from doing yoga, which I find so impressive.
You know, it's interesting. I just had a conversation recently with this really incredible teacher, author. Her name's Yvonne Telly, who wrote a book called Breaking Up with Busy. And we were talking about how people in our field, you know, yoga, meditation, self-development, how people have this idea that we just have these like really relaxing lives. And I'm like, but not really. I mean, I think everyone's schedule is the same when you're an entrepreneur or you're trying to build your own business. It's like we still create those stresses in our lives.
Definitely. I think that it's hard for anybody to sort of get the busy stuff out of their brain and have some calmness.
Yeah. Okay. So for those of you listening, welcome to Radically Loved podcast. I'm so excited, as you heard, to be talking to somebody that is legit. I'll let you tell the audience a little bit about yourself, but I am so excited to dive into some questions I have. So for the people listening, I have Dr. Jennifer Haythe on today. I'm trying to add a clap track so that we can have a little like, yeah.
I like that.
If not, everyone listening, just pretend or just clap, pretend. So for the people listening, you guys, we're at no, please go ahead. So just so you guys know, those of you listening, Jen's actually at work right now, which we want her to be at work because we want her doing what she does best. So you may randomly hear her getting calls or people coming in, and just we'll make it part of the show. So
I'm trying to keep it to a minimum.
All right, Dr. Jen, welcome.
Yes, thank you.
So for the people listening, will you give us a little bit of background as to who you are and what you do?
Yeah, so I am a cardiologist. I work at York Presbyterian Hospital Columbia in New York City, and I specialize in advanced heart disease, so people with advanced heart failure, people who need transplant, people who've had a heart transplant, and I have a special interest in pregnant women, so I take care of a lot of pregnant women with heart disease. And that's what I do.
How did this happen? Like, did you always want to be a doctor, or like growing up? Where did you grow up?
I grew up in Connecticut.
Okay.
We lived in Stamford, Connecticut, and I didn't always want to be a doctor. I think that I really liked science when I was a kid. I was a little bit one of those dorks who wanted my mom to order like a pig and a frog for me to dissect in the backyard, like already dead, obviously. And I just really liked it. So I really liked science. But I also liked other things. I liked reading and I liked history. And so when I went to college, I was actually an American history major, and then I did pre-med. And I think it was in college that I really realized that I wanted to take the pre-med courses and be a doctor, because I couldn't imagine having a job where I sat at a desk all day. And I wanted to have a job where I worked with a lot of people and helped people. And I wanted to feel like when I looked back on my life, I felt like for me, what was important was feeling like I had helped people, basically.
Yeah. And so you took it upon yourself to put yourself through this journey and to work with women in particular, and what spawned that?
So I found, first of all, I love women. I have a lot of women in my life, and I have lots of great women friends. So I'm like a woman person in general. And then
Ditto.
Yeah. And I just felt like women were really being sort of undertreated, underdiagnosed, undercared for. I think that in the world that we live in now, there's a lot of recognition of how women are being mistreated in business and in work, and the Me Too movement. And It's the same in medicine. It's the same, in hospitals, and it's the same with patient care. And, when you look back at how women, particularly in cardiology, which is my area of interest, have been treated in terms of, research and diagnosis and then treatment, it's so much worse than men, and just really pretty shameful. So when that all came upon me, I realized I really wanted it to be part of my mission to go and try to make women more aware of their risks and try to help them reduce those risks.
Yeah, and this is actually something I was reading about a couple weeks ago, maybe when we connected. It just kind of spawned this whole study, where I was reading all the statistics and how the statistics of women getting misdiagnosed or not getting the proper not getting the proper care in regard to their health, and how obviously it's like anything else, if people don't know what they're looking for, or as patients, we don't really know what the signs are. So I was hoping that you can speak to that a little bit so that we can really understand what it looks like to be healthy, and why our heart health is so important.
Yeah, so I think that when you look at women and how they've been treated in the entire medical field, and in cardiology in particular, I think that there's been a real bias against them for a lot of different reasons. One is that heart disease was really thought of as a man's disease, and it was presented as such in pretty much all the media that you can imagine. So in TV, in movies, in books, there's always male characters that are dying of a heart attack, that have, you think of the smoking, big, red-faced, angry man having a heart attack, or, things like that. And never do you see a woman with suffering from heart disease in any of those scenarios. So I think there's sort of a cultural bias against women. And then there was a lot of scandal sort of in I guess it was now like the 60s when the thalidomide disaster happened. And basically because thalidomide, which I don't know if you remember, but was used as a sedative in women who were anxious. And then it turned out to cause a lot of severe birth defects. And that happened a lot more in Europe than in this country. But as a result, the FDA really stopped women from participating in any research trials because they were really, it was born out of good reason. But as a result, now women have been really excluded from so many of the randomized trials we have studied to look at, medicines and treatment of heart disease. And so I think now women don't realize for so many reasons that heart disease is their number one killer, and it's more than all cancers combined. And that's a really shocking number that most women don't know. And they don't talk about it with each other. They're not aware of it. Their doctors are often not aware of it. So I think
my goodness,
that message is important to get out there.
Wow. Yeah. And why do you think that is? Why is it? I would have thought it would have been cancer, not heart disease.
Yeah, no, it is heart disease. And heart disease really encompasses so many problems. Cardiovascular disease in general, it's heart attacks, heart failure, secondary effects of hypertensive heart disease, diabetes, high cholesterol, valve disease, arrhythmias. There's so many kinds of cardiovascular disease, stroke, and so that is really important. And I think that for women, they should know that they don't need to be embarrassed. They shouldn't feel like there's a stigma attached to having a diagnosis of heart disease. And in fact, there's so much you can do to change your risk factor profile as opposed to like cancer, where you get cancer and you have cancer,
Yeah.
You can get chemo and surgery and, but in heart disease, you can really like lower your risk by treating your high blood pressure, treating your high cholesterol, like exercising, weight loss, so there's a lot of interventions which make it a disease that I think is really positive, and there's a lot of things we can do to help people. So that's what I really like about it.
Yeah, no, it's great that we're having a conversation, because I feel like it's for me, when I was a teenager, I was diagnosed with extrasystole. So, and I had no idea what that was. I'm like, and nobody knew. Everyone's like, oh, just let's put her on some Xanax and like, it'll fix it. But it's, it was heart palpitations, right?
Right. Yeah. And that's the way a lot of women are treated. Give her some Xanax. She's having an anxiety attack. Women go to the ER and they say they have chest pain, and, they're often dismissed as being anxious, panic. There actually used to be a diagnosis of hysteria for women who were, this is back many years, going back decades. But God. That's why women feel embarrassed. But in fact, it isn't hysteria, it's heart disease. They need to be treated and evaluated appropriately. And maybe it isn't. But at least you should get the same workup as a man would get.
Yeah. So how do we how do we go to the doctor and ask for a diet? Do we have to go to a cardiologist? Would you recommend us women at a certain age going to the cardiologist, or what does that look like for normal people?
Right. Well, depending on your age and your risk factor profile, and, women should start being screened as early as in their, mid to late 20s for risk factors for heart disease. And so the first thing that women really need to know is what the risk factors are. And for women, so first of all, very important is family history. So if you have a parent or a sibling who's had a significant, cardiac event or a heart attack, before the age of 50 or 60, that is something your doctor really needs to know about, because certain genetic predisposition will exist regardless of if you, go to the gym 7 days a week and, are incredibly in shape. If you have high blood pressure, diabetes, high cholesterol, smoking, And then in women, newly identified risk factors are preeclampsia. So that's when you develop a hypertensive disorder in pregnancy. That is a risk factor now for heart disease. Premature delivery, also a risk factor for heart disease of the woman. And so, as we learn more about these risk factors and women are more aware, they should go to their primary care doctor for their annual or to their GYN and say, have you assessed my risk factors for heart disease? Do I have any risk factors? And that should be done every year. And then if you do have risk factors or you are having symptoms, you certainly should get more workup, like possibly a stress test or an ultrasound of your heart. I mean, there's a lot that can be done, but depending on what you tell your doctor.
Yeah. Okay. So it's really a matter of us being aware of when that time is, and to just be, hypersensitive to our current state.
Exactly.
Okay. And what would a normal healthy heart look like, or what does it really look like to be healthy? Like, for example, I love cardio. I love doing lots of cardio. And is it something that's contraindicated if you have a history of cardiovascular disease? Is it hereditary?
So we want everyone to do cardio if possible. So if you can get your butt off the couch and do it, it's great. I think that, there's some studies showing lately that, maybe 4 times a week, 45 minutes, 30 to 45 minutes of cardio is the optimal amount of exercise for people to do. I mean, really what we want is people who have, had a heart attack or who have certain valve disease or have heart failure. Those people will need to speak to their doctor about what is and isn't allowed. And certainly, for certain periods of time or with certain arrhythmias, your doctor may say to go gradually or to not get your heart rate over a certain amount. But in general, most people should really try to do cardio 4 days a week with, a good heart rate response for at least 30 minutes of that. And I think that what our goal is for people to feel like that they're healthy. And so that sort of begs the question, well, what is healthy? And we have a lot of different ways of defining health, I think, in our society. So healthy may mean to one person that they are really happy and enjoy their life, and they may not exercise that much. And to another person, healthy may mean that they work out 7 days a week and their, resting heart rate is 50. And somebody else, it may be, I want to, be able to always walk on my own and not get old and have someone have to help me. And so I'd rather die before that happens. So, I think it really, depends. Some people don't ever want to lose their vision. Some people don't want to lose their hearing. Some people never want to lose their independence. And I think most people probably would argue that healthy means, you live your life, you're very active, you can do whatever you want to do, and then you drop dead at a certain age without any suffering. Yeah. Right? I mean, that would be the goal, that you don't get, hospitalized multiple times and have to suffer. And so from our perspective, the best way to keep your heart in that condition is to, exercise, eat healthy, make sure you, have things in your life that you enjoy, like that reduce stress. Like actually yoga has been shown to reduce blood pressure and lower resting heart rate and improve, mental stress, which is also a huge issue for people with heart disease. And certainly stress can trigger cardiac events. So, I think people have to fill their lives with the things they enjoy. But from our perspective, healthy is, ideally getting your heart rate up to your, target heart rate for 4 times a week.
Yeah. Oh, that's good. Well, that's
but
great.
Also having good cholesterol and not having diabetes. There's right. So many things.
So how does that? Yeah. So how does our diet obviously plays in a role in all of this?
Mm-hmm. So we, my feeling about diet is I'm really not a fan of fad diets. They don't work, and I don't think people ever stick to them. And if people lose a couple of pounds, it's almost always related to losing water weight. So the diet I always tell my patients to stick to, and which is really, there is actually some data to support it, is the Mediterranean diet. So a diet rich in olive oil, not butter, no fried food, lots of legumes, fish, minimizing red meat, nuts, vegetables, fruits, things like that. Whereas that's basically the DASH diet is another one, which is very similar to the Mediterranean diet, specifically designed to lower blood pressure and also minimizes a lot of the salt in your diet. So that's the diet I encourage my patients to stick to.
Oh, that's really good. I mean, I've studied both of those, the DASH and the Mediterranean, and I think they're really great. And I've definitely read a lot of, studies that people have done that actually helps lower that. Is there anything that you would not recommend?
I don't recommend people to go on these high protein, ketogenic diets. I think that they're really not healthy.
Let's talk about that. I think that's
Why are you a big fan?
I'm so surprised. No. I'm surprised because it is something that people are really doing a lot of right now.
Yeah. So I have always felt like we as human beings can process a lot of food. I know there's a lot of different theories about what's best, but I've always felt like if you eat a balanced diet and you're healthy and active, you're getting all your nutrients you need from your diet, right? Mm-hmm. And I don't think it's appropriate to only eat, excessive amounts of one food group. The same way that, it's not good to eat only sugar. I don't think you should only be eating high protein, and excluding all of the things. Your body needs, some fat, some carbohydrates, some sugar. And I know it's not sexy and it's not, exciting for people to hear. And I certainly think people lose weight on a very high protein diet, but it's not that sustainable. And it's just, I think that it's, sort of ignoring the fact that we need some balance of all the different kinds of food groups, and the ability to process those and get those to our different parts of our body is important. So but I think that it's boring, to say you need to have a little of this and a little of that. And our culture is so driven by, extremes, and people buy more books about celiac disease than they do about heart disease, even though they're most likely going to die of heart disease, So it's just not an interesting topic for people, but it is actually, the middle of the road, and moderation is crucial. Like, you can have a glass of wine here or there. You can have a steak now and then, but it's like you don't have to do everything to such an extreme where you only eat steak or you only eat eggs.
Yeah. Well, some of these, people that I know are like having steak for breakfast, lunch, and dinner, like every day. And I'm just like,
right.
Boy,
Right.
I mean, I do personally, I do more of a, plant-based diet. I mean, that's
right.
typically how I eat. And I have celiac. So it's like I've been gluten-free since back when I was diagnosed with my extrasystole, like back then,
right. Well, that's interesting you say that, because I actually know several people who've had palpitations related to a diagnosis of celiac disease. And it certainly has. Yeah, it has an interplay with heart disease for sure. But, there is celiac disease, and then there's people who decide that they don't want to eat gluten anymore.
Right.
Celiac disease is a very specific disease that people cannot process, wheat.
Yeah,
and
exactly.
it predisposes you to cancers and other things. And those people need to stop, eliminate wheat from their diet. But that is different from just everyone saying, I want to go carb free and go gluten free because they feel it's healthier, because they're two different things.
Yeah. So for those of you listening, I think it's really important to make informed decisions.
Exactly.
And not just jump on the bandwagon of something that's big. Yeah, I can't ever imagine. I always think about those things, or like, what was that one? The Atkins. And
that's like a ketogenic diet, right? Where you eat very high protein and almost no carbs.
Yeah, I'm just like, what are your poor insides doing with all of that?
Right. I mean, people actually develop like ketotic smelling breath, like they have that sweet smell from the ketosis that's going on in the breakdown of protein, and which is what we see in diabetics who are having, a diabetic crisis. And so things like that to me don't seem rational. I'm a much more of a moderation person.
Yeah.
Have some, I will say that I'm not judgmental though. So if you are doing some kind of diet where it's, gluten-free or meat-free or heavy meat, and you feel great, then that's your choice. Then I think that's great for you. But I don't know that everything works for everyone. And I think that my goal in our society, where, there are certainly people on the extreme ends of health and wellness and fitness, But what the bigger problem aren't those people, it's the people in the middle who are eating McDonald's and fast food and processed food, where the first goal should be just to move away from like what I call fake food and eat actual real food, which is, vegetables and fruits and, things like that. Because I think that, everyone's wonders, well, why is our society so obese? And why is there so much diabetes? Why are children developing diabetes? And it's because they're eating bad food, and it's getting passed down from generation to generation. And so we really need to educate people and try to minimize the exposure to those kinds of foods, I think.
Yeah, I mean, I totally agree. I mean, this has been the ongoing conversation in just our culture and our society about how easily accessible fast food is and how inexpensive it is, and people just not making. And I understand. Look, I've done a lot of work with, at-risk youth and working with communities that, have, socioeconomic barriers, et cetera, so I understand that it can be a financial thing, but I still feel like it's a choice. You're still going to spend less money on vegetables than you are on like processed meat products. And, I feel like it really comes down to just making the most educated decisions that you can. A quick message from our sponsor. If you're looking for a nutrient system that truly embraces and complements the mind-body balance in a holistic, nurturing way, then wellness kits from Uveda are your natural answer. They're created with the help of naturopathic and Ayurvedic practitioners committed to the healing tradition's mantra of purity and harmony. These top-quality ingredients are hand-picked and refined in a way that preserved utmost quality and potency. Discover a wide range of formulas that deliver essential fatty acids, herbs, probiotic strains, and enzymes to help support your health and wellness needs. Whether you're looking for a natural detox support, a gentle digestive aid, soothing probiotics, or a formula dense in vitamins, minerals, and antioxidants, you can be assured you're getting only the best natural healing remedies for your body. Go to uveda.com, that's YOUVEDA.com, and enter the promo code ROSIE, ROSIE, for a special discount on your first purchase.
I mean, we also live in a society that's so heavily, wrapped up in corn and corn syrup. And, there's so much corn farming and, there's so much extra corn available so that, making things with corn syrup, which we know is horrible for people, is also just so much a part of our society's food, as opposed to other parts of the world where they don't do that at all. They don't use corn syrup. They don't do that. That's another thing where I feel like we were mentioning earlier, is I'm a big fan of just drinking water.
Oh yeah.
And I think a green juice is okay, which is vegetable based, but this sort of like juicing concept to me is a little bit counterintuitive, because when you base these juices that people buy at these juicing stores, that's all sugar. I mean, that sometimes is, equal to 10 to 12 packets of white sugar. The amount of sugar in those big, like a Jamba Juice or whatever those places are. And that's actually not good for you. and then, people are on a juice diet, and I'm like, well, it's not really a diet.
So like, or a juice where people, like I've done juice cleanses in the past, but I think that exactly what you're saying, it's like, so if you're doing a juice cleanse with like a little bit of celery and pineapple and apple and pear, like all the sweet stuff. I mean, is that still, do you think that that's also, creating that blood sugar spike?
I do. I think that if you're, putting down on a juice cleanse, however many ounces of juice, however many times a day, that's basically like drinking sugar water. And, there's some other nutrients in there from the fruit, but, I try to tell people it's better to try to stick to a green juice. Maybe there's an apple, but the rest is plant-based stuff, that doesn't have as much sugar in it.
So it's like sugar is
sounds
sugar.
Healthy.
Yeah.
Right.
Yeah.
But it's not always healthy. It's just a lot of sugar.
Oh, I'm so glad that you're speaking to this, because this is like one of those things that I've never heard anybody else in the
mention
health
that.
and
Well,
wellness.
that,
Yeah.
yeah. Well, this is what I say with children. We're like, every time you look at a kid in a stroller, they're drinking like an apple juice or an orange juice. And then we wonder why our children are becoming obese. It's like, they don't need to drink juice. They can have water. There's no reason that they need to be drinking like a cup of basically sugar, and if you don't introduce it, then they don't know about it. So they stick to water, not saying you have to be militant about it, but just recognize what you're doing and how it affects over years, how that develops into, how they're processing sugar and what they're expecting to drink. Because it's just orange juice and apple juice is going to lead to like Coke and Pepsi and, more sugar down the road.
Yeah. Yeah.
So, yeah, I think that we need to move away from that.
Yeah. Well, and one of the other things I wanted to ask you about is, I'm like, I have a friend who, she would like, drink these little organic energy shots when she would get tired and then go to, work out. So what's your feeling of those little energy shots with like B complex vitamins and all this? There's caffeine in there, obviously. And,
right.
yeah. Go ahead. No. Go ahead. Well, I'm like, and say this friend has had a history of palpitations. So let's speak to this friend.
So here, I think vitamins have really never been shown to do anything to improve morbidity and mortality in people. Occasionally, people have real vitamin deficiencies that they're either born with, or certain things that they're really because they have been depleted in their environment. But in general, supplemental vitamin use, despite what everyone says, there's really no randomized studies that show a benefit. I mean, even sadly, fish oil, those studies have been very neutral on heart disease. And while I think there are benefits to fish oil in terms of like, hair and depression and all kinds of things that omega-3 fatty acids do, it's not clear that they are the magic bullet either. So what I tell people is you can drink vitamins. Chances are you're peeing out most of that. And that's why your urine turns bright yellow, is because all of those pills are made with, tons of filler and, to hold all that stuff together. And then most of the time it's coming out when you go to the bathroom. So I think that the best place to get vitamins and nutrients is from your food and your diet. The best place, if you do have, certain conditions can lead to vitamin D deficiency or things like that. If you live in very, sunless places, and you can certainly take supplements. But I think that in general, those shots, it's really the caffeine that's giving you an energy boost right before you work out. And caffeine is certainly linked to causing heart irritability in people, especially who have palpitations. It's not going to kill you. It's just going to maybe make you have more palpitations and be more your heart's going to be a little more irritable. Yeah. But I do think that those pure energy, like what you're describing, sounds kind of like an organic energy drink with vitamins and a little caffeine. But those like Red Bull, those high caffeine, those are not good for people. And especially young people should really stay away from those.
Oh my goodness.
They're not.
So we have my little 19-year-old sister. We've acquired her like 2 years ago. So my partner and I are raising a teenager. But like she'll come in, she doesn't do this anymore, but like she would come in with this huge Monster energy drink, like huge. And I'm like, oh my goodness, like this can't possibly be good for anyone to be drinking.
Right. No, all it's doing is giving you a ton of sugar and caffeine. And then it's causing like a huge blood sugar spike with a huge release of insulin. And then the aftermath of that is to actually probably feel more tired, but it is going to make them wake up. It's certainly going to make them, more alert for a little while, but it's a trade-off and it's not actually particularly healthy.
Oh my goodness. So I'm like, so many things. This has been most enlightening. This is our segment of health education here on Radically Loved podcast. So I have a couple more questions, and I want to be respectful of your time. I know you have patients on the wing. So what would be like the top 3 things that we can do for our heart health that you can share with us?
So I think, I don't know if this should count, but I want all, whether it's women or men listening, but especially to the women, I really want them to make like even a well woman visit if they're feeling okay. And if they're not feeling okay, to make a doctor's appointment and really go and insist that you be evaluated for all of the things we just talked about, because it's the same way that you would get a pap smear or a mammogram. You need to go and have your heart assessed and your risk factors assessed for all the reasons we've talked about, and especially because cardiovascular disease is probably what's going to kill you, as a woman. The second, so that's sort of like just the overarching thing. The next thing I would say is to really try to look at your diet, look at how you're treating your body, whether it comes to, processed foods or alcohol intake, drug intake. These are all things that people do, and I understand that there's reasons that people do it and they want to relax and this and that, but they are toxic to you. And the whole a glass of red wine a day, I mean, that's not actually clearly shown to be true. And in many people, alcohol is a cardiac toxin. So again, I'm back to this moderation thing. Yeah, I mean, we see people who develop heart failure purely from alcohol abuse. So
wow.
What we tell people is, I never want to tell people you can never drink again, but like, have a couple drinks now and then. You don't have to drink every night, especially if you don't really need it. So that's another thing. So diet and then I would say exercise. Mm-hmm. And I always tell, especially my women, like, you don't have to be thin. Being thin does not necessarily improve your morbidity, mortality in life. In fact, women and people who are a little bit heavier are sometimes actually at lower risk long-term because they have more reserve. So as they age, they're not as frail as some particularly skinny people. So I say focus less on your weight and more on your activity level. It's the insides that I care most about. So get your heart rate up, walk, put your running shoes on, do more activity. And then the third thing I would say is really like stress reduction. So whether it's a yoga practice or listening to a meditation app or doing something you really enjoy or, being outside, whatever it is that helps you reduce stress and get a good night's sleep. Because again, sleeping 7 to 8 hours a night, I think there's been a lot of attention on sleep and the importance of sleep. It really is very important for your body to sort of restore itself. And the same for stress reduction. I mean, people have heart attacks when, there's a whole syndrome called stress cardiomyopathy where women more than men will have a very stressful event, maybe a death or a divorce or a fight with someone, and they develop a heart failure syndrome acutely. And that's called the broken heart syndrome. And it can resolve and will get better, but these women will present like they're having a heart attack and their heart looks abnormal and then it gets better. So we know there's a connection between the brain and your emotions and your heart, and they're interconnected and linked in a way that we can't ignore. So, that's probably my third recommendation.
Oh, I love that. Thank you. Oh my goodness. This is like, okay. I feel like we should do this, like every week, like just so we can start really spreading the word. I'm so grateful that you came onto the podcast. I feel like you spoke to, all the things that are of concern and even things that we could probably elaborate on some more. But I want to be respectful of your time, obviously, but for the people listening who want more information, maybe about you, or they have a particular question, or they want more information, where would you recommend they go?
So for me, I mean, I'm on Twitter, so they can see I'm like Dr. Jen Haythe on Twitter, so they certainly could follow me or instant message me on Twitter or direct message or whatever it's called. And if they live near me and in New York, you could certainly make an appointment with me or one of my colleagues. We've created the Columbia Women's Heart Center. You don't have to have advanced heart failure to see a cardiologist, right? You can see a general cardiologist, and we have like great women doctors and male doctors. But, we have a whole center for women who've had chemotherapy related heart disease. So, we're trying to cover all the bases. So I would say you can make an appointment. You can make an appointment with your doctor. And I mean, I've written a couple of little articles online. You can read about certain, women's related heart stuff. But certainly if they have questions, they can reach me on Twitter. And they can also reach me through Columbia.
Okay, great. So
through my office. Yeah.
I will, I'll put those, for those of you listening, all of those links will be on the show notes. So if you go to the show notes and you click info, I'll have Dr. Jen's information on there, so you could just email her or message her or make an appointment there directly. Is there anything else you'd like to share with everyone?
What would I just, I just want people to pay attention to themselves and treat themselves kindly. And, it's never too late to change. Even, I'm always trying to figure out how I can change my own routine to make myself, feel better and be healthier. And so, it's never too late to change, especially with heart disease. You can make so many changes, whatever age you are.
Oh my goodness. Well, thank you, Dr. Haythe. I keep calling you Dr. Jen. I'm like, what's up, Doc?
You can call me Jen. It's fine. I have to take a yoga class.
I know. So I am so grateful for all the work that you're doing and for spreading this knowledge that I feel so many women, everyone, especially women, need to hear. And so I really hope that you continue this work. And I'm so grateful that we have incredibly smart, bright, beautiful doctors like yourself out in the world helping us. So thank you.
Oh, thank you. And thanks for having me on.
Thank you so much. Thank you. Do you want to go on an epic yoga adventure? I do. In fact, I do all the time. When do I not want to go on an epic yoga adventure? And this fall, in an attempt to see the Northern Lights, we will go to Iceland into a journey through the chakras. It's going to be fun. If you're curious, you can email me at rosie@radicallyloved.com or go to the show notes and click the links to each of the retreats, or you can go to radicallyloved.com. See you soon. Hey everyone, I hope you enjoyed this episode. I am so excited to continue to do this. Please share this with your friends. Email us, message us on Instagram at Rosie Acosta or on Twitter at Rosie Acosta. Subscribe on iTunes, write a review. We love doing this, so please help us continue to keep this podcast going. Thanks for listening.